everyone. We acknowledge that Western University is located on the traditional lands of the Anishinaabeg, Haudenosaunee, Lenni Lenape, and Chinookan nations, on lands connected within the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. With this, we respect the long-standing relationships that Indigenous nations have to this land, as they're the original caretakers. We acknowledge the historical and ongoing injustices that Indigenous peoples, First Nations, Métis, and Inuit endure in Canada, and we accept responsibility as a public institution to contribute towards revealing and correcting miseducation, as well as renewing respectful relationships with Indigenous communities through our teaching, research, and community service. My family's journey to this land began in the 1900s when my mother's family immigrated from Lahore, Pakistan. Being born and raised in London, Ontario, I grew up within a colonial state, shaped by systems and ideologies that continue to uphold inequities and undermine Indigenous teachings. And I am on a continuous journey of learning and unlearning within my own life and nursing journey. Newcomers to Canada may also navigate the complexities of colonial healthcare systems, while also learning about Indigenous histories and realities. This experience of learning, unlearning, and reorientation is powerful, and it positions us all to become thoughtful allies in reconciliation. As healthcare providers, our role is to recognize that the injustices against Indigenous peoples have not ended. We must together commit to dismantling the systems that continue to harm Indigenous people and push for healthcare models built by and for Indigenous communities. This means advocating for Indigenous governance, supporting policies that reflect Indigenous priorities, and ensuring trauma, violence, and culturally safe care is our foundation.
Thank you very much for that meaningful opening, Zara, and thank you for also sharing your reflection in relation to that personally, as well as our topic today. So I asked Zara to share the land acknowledgement today also because one of the things we like to do at DARAO is really focus on students as partners and collaborators in the work that we engage with. I think it's a really important thing for us to all reflect on power dynamics in our workplaces and how that impacts activities moving forward. So for us at DARAO, student collaborations and trying to dismantle those power barriers and give students power back is one of the things that we're really focused on. So today's subject matter, we're focusing on internationally educated nurses. And here we picked this event because we really wanted to have a meaningful dialogue about the experiences of internationally educated nurses and raise awareness of potential ways that we can have some really actionable change to some of the current challenges that we're seeing in Canadian healthcare contexts. So the first speaker that we'll have today of our three speakers is Dr. Ruth Lee. Before I introduce her and Edward, I just wanted to share a little bit of a story. Last summer, I attended the Canadian Association of Schools of Nursing conference, and Dr. Ruth and Edward were actually both keynote speakers at the second day of the conference, and both of them together shared a really powerful and moving learning experience for me, essentially, and all of the colleagues that we had in the room that has still kind of impacted me to this day. So as soon as we had a discussion in our DARO group about we wanted to have a conversation around internationally educated nurses and creating safe spaces for them, I immediately thought of them. So I'm really looking forward to hearing their perspectives today. So we'll start off with Dr. Ruth Lee. So Dr. Ruth Lee is the Executive Director of Care Center for Internationally Educated Nurses. She's an Associate Clinical Professor at McMaster University School of Nursing. Ruth obtained her BScN and MScN from the Faculty of Nursing and her PhD from the Institute of Medical Sciences at U of T. Ruth's clinical and administrative expertise spans from staff nursing, clinical nurse specialist, program manager, and chief of nursing practice in various large academic, acute, and long-term care settings. And her education and research interests focus on diversity, cultural competency, integration in IENs, and health human resource planning. So thank you for joining us today, Ruth, and I really look forward to hearing from you.
So you're going to introduce all three, or you're going to go one by one?
I usually do it one by one, like
okay.
if that's okay with you.
No problem. And would you like me to share my screen? I just have a few
Yes.
slides to
Yes, please.
keep me in check.
Yep.
For those of you who know me, I tend to talk a lot. So I'm going to keep myself in check here. So I'm going to share my screen. So I bet you Richard is smiling here because he remember how much I like Sandra Fang's work, and so the title to the presentation is barrier and facilitator. So it's not in research utilization, it's part of it, but again is how to the barriers and facilitator to educating and integrating international educated health.
Now, before you get started, Dr. Lee, the way that you shared your screen slides, I can see like your speaker notes and your next slide on the side instead of your slide. I don't know if you wanted to try to change that.
Okay. Not good. Okay, so what I would do, would you like to share the slides, send you the PDF?
Yeah, sure. I might have them, sure. Just give me 1 second. I have to pull them up in my. Whoop. I'm just doom scrolling my email for a second here.
Anyway, when yeah, Ashley is trying to get my PDF slides, I can start talking rather than wasting time here. So CAS Center for Internationally Educated Nurses, where I work for the past 8 years, is a nonprofit organization funded by the federal and provincial government of Ontario. And we've been around for 24 years, so next year will be 25 years. So it all started by the challenges that face IENs way back when, in like a quarter century ago, and it's very heartbreaking to see that the issue is still there. So yeah, you can move the slide for me. So so here's basically it. So we have Ontario-based services to help IENs from the beginning, before they get the license. As we all know, without your license, you cannot practice. So we started with the Ontario government, and then we got support from the federal government to prepare IENs before they come to Canada. Because what happened is we have a time limit, as you know, in Ontario, 3 years. And then no offense to my male colleagues, but you know that how women, when they settle their family, is they may only have a year left or less. So it's very, very complicated process. And so at that time, we started in 2016. We're able to get funding from the PRY for full service. So what that means is that prepare the nurses with all the documents, let them know what kind of reality it is. A lot of the IEN do not know. I never forget the time that one of the IEN walked into McMaster University Medical Center and looking for a job, and they are so shocked to find that I've been working in ICU for many years, and you're telling me I cannot even be any kind of nursing. So it's all this confusion that the international educated nurses are not realize that you know, they will encounter barriers. So we started the peer arrival service in 2016, and then I have very good news for you. We just got funding yesterday to provide a pre and post service, pan-Canadian, starting April 1. So we're very delighted about that. So we still have our full service in Ontario, but now we have satellite services across the land. So more to share later on. So if you can advance to the next slide. So here are the barriers and challenges. And this is not news to any one of you, but particularly those attended as international educated nurses. So the complexity is beyond belief. So if someone who's been a nurse for 20 years, they come here, they basically treat it as a new grad. Okay, so there's challenge of that. For those of you who've been in maternal infant, for example, and I don't know about you, if you ask me what is happening in orthopedic nursing for adults, I will be at a loss. So a lot of those issues that very, very complicated. So because the exam itself is entry to practice. So, and there's many requirements before you can even write your exam. And not to mention a lot of courses associated to doing upgrades, apply for the nursing assessment, to deem that you're competent to write the exam or not, even, and your clinical experience, evaluation, very, very challenging. And that's why we need to support those folks. So many of you as educators, you know that Canada, particularly McMaster, I'm going to blow my horn here, that are very much into the OSCE, objective clinical assessment exam, right? So they may send to a Touchstone Institute and do simulated patients and all that. And it's absolutely at loss. Many of them are very, very lost. They have no idea why this is happening. And then the lack of local experience. So they need to put food on the table, right? All of us. I don't know about you. I don't think I can afford not to have income for a year, right? So you dip on your savings, not to mention the exchange rate, as majority of the IENs are from third world countries. So as you know, the major pipeline right now from the Philippines and India. So many of them save a lot and they come here. The income is a huge, huge challenge. And the local experience, many nurses will say, can I buy Canadian experience? So even it's illegal to ask that question, you know, or require Canadian experience, it's still being asked that you need to have Canadian experience. So this is another barrier. And many of them have never looked for a job, have never done a CV, never done a resume, because when they finish school, automatically you have your license, you practice. So they have to learn all this, and not to mention many of the jobs are whom you know, right, rather than what you know. So they don't have an established network to make that happen. So it's a huge challenge, and language is another challenge. So many employers will have no patience listening to someone like Ruth Lee here, speaking with an accent. It takes a while to get used to the accent, right? And then when IN become anxious, they speak faster. And that's why a lot of times, and then employers, you know, interview, whatever, we start raising their voice. But I keep on telling my team, you know, when I was at the hospital center, I can guarantee you that 100%, if I would say 99% of the IENs will not have a hearing problem. For you to raise your voice and literally shouting at them is not going to make communication any better or easier to understand. Many have to relocate to remote areas to find work. And it's very, very tough because many of them are so used to living in large urban environments. And the fact that the cost of living is so high, grocery and housing is so expensive, it's create a lot of challenges for the IEN to simply survive and know and adjust to the Canadian weather. Learning how to walk, can you imagine, is an issue when we're so get used to it. EDI is something that they're not familiar with because majority are from homogeneous cultures. So that's another great support in the workplace, but again, is another thing that we need to provide that understanding for the IEN so they understand the rights that they have and when to speak up, because many of them are so afraid to speak up because they're so vulnerable. So I'm going to share, other than the barrier and challenges, going to share some of the solutions the CARE Center provide quickly. Okay, if you can advance the slides, please. Okay, so this is basically the process. So I don't expect you to read everything. I'm going to leave this with all of you. I'll be happy to share the slides with you. So basically, it's the three major things, the steps, right? So for those of you graduate from a Canadian nursing school, you may not know the challenges the IEN have to go through. So these are the major process before they even allow to write the exam and meet the registration requirement to post-registration, all the challenges and everything in between. So when you look at the bottom bar, this is what CARE Center do. to help them overcome those barriers and challenges. So we start with a one-on-one hand-holding experience for the IEN. We have case managers, more than half of them are IENs themselves, sharing the experience, holding the hands, and also come to a point to say, okay, enough complaining, enough venting. I hear you. Let's see how we can work together to make it better. So we will be the one that talking to the college, getting the most up-to-date information, getting the most up-to-date support out there, working with many, many partners. So one of the things that we are very proud of, I was just talking to Therecia that this past Monday, my team was at the London St. Joe's Health Center to present on workplace integration, basically supporting the employer to welcome the IENs and integrate them into the workplace. So you can go to the next slide, please. So here, this is the IEN have to go through. Actually, all of us have to go through to get your license. So as of now, we have 8 requirements for one to get a license to practice as nurse. As of April 1, we have one more. It's called transition to practice. So I'm very pleased to let you know that CARE Center have worked with University of Toronto Continuing Education, as well as Toronto Metropolitan University Continuing Education to offer courses to help IEN meet the need of meeting that requirement to get their license. So next slide, please. So these are the professional development workshops and courses that we offer, and I don't expect you to look at it, but just show you the 4 buckets that we think that the IEN need in terms of overcoming the barriers: communication and workplace integration, nursing essential skills. Many of them have never seen a pump that we use here. Many of them have never used electronic documentation. So we should have a lot of work to do for the IENs, I can tell you. And then also license and the exam preparation. So I mentioned the new thing coming, April 1 is offering the last requirement support, and also employment and career development. We have 28 formal employers across the province, and more will be coming. So we're very happy that we can make that bridge, because all the way from pre-arrival to post-arrival, wanting to find a nursing-related job, I absolutely do not want to see any IENs washing dishes or pouring coffee somewhere. I really like to see them into the workplace so they can get an early introduction and orientation to the Canadian workplace. Next slide, please. And one of the things that we're very proud of is we have the mentoring program, offering the job shadowing, that we have partners I mentioned earlier to spend time at the workplace so they can observe how nursing is being provided at the workplace. So by the time they become registered, finding a job, they already have some networking done and they already know the workplace environment. Over COVID, this is one of the things that we gained out of the crisis of COVID, is the virtual mentoring. When the whole province shut down, we were able to do that, to provide that mentoring support to our IEN through wonderful partners. London Health Science and St. Joe's London are wonderful partners to make our program available to the IENs. Next, please. I think that, yeah, okay, I mentioned about the workplace integration program. We just offered sessions this past Monday at St. Joe's London, and we have some seed money to start that program. So we're very pleased that we have close to 1,000 participants in this past year when we did this pilot. And right now it become an integral part of our programming. So that's my piece of presentation, and I look forward to our conversation later on. Thank you.
You're muted, Ashley.
Oh gosh. Thank you. Thanks, Richard. I was saying thanks so much, Ruth. And I wish these Chats could sometimes be 3 hours because there's so much we have to learn from everyone that participates. And one thing I can say is also in my limited experience in learning from Dr. Lee, she is also very funny. And one of the lasting messages that kind of hit for me in the last presentation I watched you share, and even your example today of international nurses might have not seen our pumps. So just to really help me to imagine how much learning needs to occur and how much work that would be for someone's mind. You made a very good joke actually at the Cause and Conference when you were new in your nursing career, where someone had told you OT was coming and you were running around and you were very nervous. You had to prepare a client completely and utterly to go to the operating theater, but in fact it was occupational therapist that was coming. So it was a very great joke at the time, but it also really landed well for me in terms of just remembering how such small nuances in our practices can really, be emotionally laborious for us. So yeah, okay. So next I would invite Dr. Edward Cruz to speak. So Dr. Edward Cruz is an internationally educated nurse from the Philippines, and he's actually currently an associate professor as well and associate dean of undergraduate programs at the Faculty of Nursing at our neighbors, the University of Windsor. So outside of his academic role, he also co-chairs the Partners in Integration and Education of Internationally Educated Nurses, a federally incorporated not-for-profit corporation that seeks to support IEN integration and transition in Canada. So I'll let Dr. Cruz take it away.
Good afternoon, everyone, and thank you so much, Ashley, for that very generous introduction. I would like to thank the DARAO committee at Western for this opportunity to share my team's findings. And I would also like to acknowledge my co-investigator, Dr. Christopher Romero, who is also a Filipino-Canadian scholar and an assistant professor in the Department of Psychology here at U Windsor. And I would attest, by the way, with regard to Dr. Ruth Lee's ability to be a stand-up comedian. I think that's something that she needs to seriously consider in the future. She has so much to share. Um, this is our agenda for this presentation. And I just would like to acknowledge that this project is being funded through an Insight Development Grant from the Social Sciences and Humanities Research Council. And I have no conflict of interest to declare. So Filipinos are among the fastest growing visible minority groups in Canada. Between 2011 and 2016, the Philippines was the top source country for immigrants who landed in this country. Latest data from Statistics Canada released in June 2023 indicates that there were approximately close to 1 million Canadians with Filipino roots who proudly call Canada home.
Dr. Cruz, did you have slides you wanted to share?
Oh, sorry.
It's okay.
You think I would know this by now
Well, hey,
after?
I'm the one that showed up late, so we could just blame everything on me. I could have got us all lined up a little bit better, and I apologize.
So sorry about that. So, early reports of Filipino immigration to Canada began as early as 1861, with Benjamin Flores being Canada's first recorded Filipino immigrant. Whereas Filipinos arriving in Canada from the 50s to the early 70s were mostly white-collar professionals, the subsequent wave of Filipino immigrants from the late 70s to the first decade of the 21st century saw the arrival of mostly working-class immigrant women, an outcome of Canada's migrant worker schemes. For example, Canada's Live-in Caregiver program facilitated the arrival of migrant workers to Canada. Unfortunately, while this program provided immigrant professionals an opportunity to become permanent residents after 2 years of hard labor, precarious immigration status, and low income, an overwhelming majority of these individuals remained as nannies or moved on to unskilled employment. Those who chose to remain as nannies summarized their journey in the following words: from RN to RN, from registered nurse in the Philippines to registered nanny in Canada. Dr. Ruth Lee already highlighted some of the issues, many of the issues IENs are faced with in transitioning to Canada's health workforce. A situation that we find particularly challenging for Filipinos is the visible minority label ascribed to all persons of color other than indigenous persons. The issue with the term visible minority is that it hyper-visibilizes and homogenizes these persons, creating a discourse that minimizes the broader Filipino experience, including the non-recognition of the political and economic challenges they confront in Canada. Despite the large number of highly educated immigrant professionals from the Philippines in general and the great number of Philippine educated nurses working within Canada's healthcare system, there has been limited research examining the employment trajectories and labor outcomes of this group of professionals. To date, we are not aware of any literature that specifically explored Filipino nurses' experiences with workplace transitions or their employment trajectory in Canada and how these have impacted their labor outcomes. This research is guided by Goffman's stigma theory and Afaf-Melaizes and co-workers' transitions theory. We interviewed about 35 Philippine educated nurses, and this is the breakdown. Oh, sorry, it's listed on the slide. We also interviewed Canadian educated Filipino nurses, but the focus of this presentation is on the Philippine educated nurse cases. Sorry, so we did qualitative interviews with the nurses. The interviews were audio recorded, transcribed, and managed using Atlas TI, and we used thematic analysis. And these are the themes that we gleaned from the data. And we'll talk about each of these within the next few slides. Sorry. Okay. The first theme is adversity and workplace challenges, and under this is the sub-theme starting life in Canada. Participant 36, male who was working as RN in a medical unit shared, I don't know how to write honestly, how to improve my CV. So like some people are laughing because I put my picture in there, I put my address in there, I put my birthday on there. Like the usual, you know, the Filipino resume or CV. Participant 25, male, master's prepared and working on a temporary work permit as a personal support worker said, being a family person, I want to also reunify with my family. But here in Ontario, yes, we can do that, but I cannot get them here with a salary of just a PSW, or else we are going to suffer financially. The second sub-theme under the theme adversity and workplace challenges is working with different cultures. For example, participant 18, female, said, she's a registered practical nurse and working as a nurse educator, by the way. She said, I'm always gonna be a fish out of water. Being like where I am located in this city, it's mostly white communities. So I think I'm always gonna be like different from other people here. The third sub-theme under the theme of adversity and workplace challenges is unfair labor practices. This was clearly described by participants 2 and 11. Participant 2, female, in Canada on a temporary work permit and also working as a personal support worker, said, honestly, I'm a bit frustrated and sad. In what way? Because back home, we're nurses there. I have a lot of problems. First, my employer abused me, and then that's why I moved to a different city in central Canada. Too much work, overwork. I mean, they don't pay me the right salary. Overtime work, no pay. Holiday, no pay, and sometimes I work on Saturdays and Sundays. Participant 11, female, also on a temporary work permit as caregiver, shared, I'm not happy right now with my employer because I'm underpaid, but I have no choice but to continue because it's hard to find another employer. I don't want to skip employers, having some employer to one another, and it will be cause of delay for my permanent residency application. The last sub-theme under adversity and workplace challenges is adjusting to Canadian workplace culture. For example, participant 23, female, working as RN in OR said, sometimes because they're really blunt, like they are really straightforward, I feel like it's me they're attacking, but I feel like it's not. But then sometimes it's really hard for you to detach yourself from your work that it's not you that they're attacking. The second theme is preparing for work and the role of bridging or transition education. Participant 15 summarized his experience as follows. It helped me to get a better understanding of what Canadian nursing is, to be honest. So it's really far different from what we're doing in the Philippines. So all those bridging courses, all the learnings, all the schoolings, I gained a lot from those. It made everything a lot easier for me. The third theme relates to microaggression, stereotyping, discrimination, and racism. Participant 14, female and working as a nursing resource team RN, shared the following. It's just the patient sometimes, when they see you, before you even speak, they will say, do you know how to speak English? Or because of your color, some of the white people don't want a nurse that is brown. Participant 24, female, working as RN in primary healthcare, shared this. She, referring to her coworker, assumed immediately that I got my permanent residency through nanny visa because I'm Filipina. Participant 35, working as RN in a medical unit, said, there was one patient, he told me, can you get a white nurse for me? Finally, planning for the future. This group of nurses that we interviewed aspire to actively contribute to their workplaces. For example, participant 7 said, I want to see change. I have to be on top of things, so that's the place where I should be if I want to see change. Philippine educated nurses who were interviewed in this study encountered different forms of challenges as they attempted to begin their lives in Canada to become nurses again. At least prior to or until the beginning of the pandemic, many found the registration requirements and processes confusing and onerous. Participants in this study reported unfamiliarity with sociocultural and workplace norms and practices as among the challenges they faced. Nurses who were on a temporary work permit faced increased employment precarity and exploitation. Almost half of participants interviewed participated in some form of transition education. Based on the interviews from these nurses, they reported that transition programs helped them gain a better understanding of the standards of practice and role expectations for nurses, as well as Canada's healthcare landscape. Experiences of microaggression, stereotyping, discrimination, and racism were raised by many of our participants. It is, however, interesting to note that some participants hesitated to share these stories. This may be related to the Filipinos' cultural value of pakikisama, roughly translates to getting along with others in English, and or the sense of religiosity, ipagpasa Diyos na lang, or leave everything to God. Many of our participants indicated no desire to pursue leadership roles or to advance in their careers outside of the bedside work. We wondered if this was an effect of the challenges they encountered early on or the need to prioritize between career advancement or to support the family, or if they were denied opportunities for advancement. In closing, I would like to leave you with this quote from Justice Rosalie Silberman Abella, an immigrant and retired Justice of Canada's Supreme Court. Immigrants live for opportunities, not entitlements. We don't think about where our career's finish line should be. Mostly, we are just grateful to have careers and the chance to contribute to the country that let us in. What we hope for when we work hard and try to contribute is respect and the chance to earn it based on who we are. And just to acknowledge some of the supporters that enabled this project, Care Center was certainly one of them. IFCNA, VRPN, College of Nurses of Ontario. And I look forward to our discussions after Theresia's presentation. Thank you.
Thank you so much, Dr. Cruz. I really appreciate, again, listening to you speak. Listening to Dr. Cruz speak this past summer had quite a profound impact on me and probably everyone in the audience, I would say, after he spoke, especially in sharing some of the participants' quotes like you did today, even saying, "Can you get a white nurse for me?" I don't think there was a dry eye in the audience. So your work is profoundly impactful. And I just wanted to say, I really, can have, it's really impacted my practice and transformed how I teach undergraduate students about the experiences of internationally educated nurses. So I'm grateful to learn from you. And so we have our final speaker today. We have Therecia Brooks. So Therecia Brooks is a dedicated nursing professional whose journey began as an international student in Canada, where she earned an honors Bachelor of Science in Nursing from York University in 2014 and launched her career at Mount Sinai Hospital. Over the years, she's specialized in high acuity nursing, med-surg, oncology, step-down, and community care. In 2021, she transitioned to endoscopy at St. Joe's Healthcare, and after completing Master's of Science in Nursing in 2023, she worked as a clinical scholar nurse focusing on mentorship coaching and nursing education for new graduates, internationally educated nurses, and those looking to upskill. She started her current role as the professional practice consultant in December 2024 with an emphasis on education, and she's very deeply passionate about nursing diversity, supporting the transition of internationally educated nurses into nursing practice, and addressing and navigating the impacts of racism in healthcare contexts. And I can say I've really gotten to know Therecia in the last year of my life, and I'm grateful for some of the very beautiful conversations we've shared, even in our more recent DARAO film screening. So I will let her take it away.
Thank you, Ashley, for that introduction. It's a pleasure to be here today to speak with you. I'm going to share my screen. Let me know if it's up. Okay. So today I'll be talking about fostering diversity and supporting the integration of internationally educated nurses into our Canadian healthcare system. Before I go into that, I just wanted to talk a little bit about my teaching philosophy. It really focuses on forming respectful relationships between the learner and the educator, where as the educator, I usually serve as a guide and a mediator to learning. Through this process, I have found that it really reinforces knowledge and critical thinking emerges. I usually use the metaphor a teacher as a big hug. I think that really embodies my teaching and learning values. If you can think to a time when you've gotten a hug, how that made you feel, it's a feeling of a safe environment, somebody that really values and care about you. And that's the environment I hope to have with every teaching learning experience. Also focusing on adult education philosophy. In nursing, we mainly educate adult learners. And so really having to value individuals' beliefs, values, and attitude towards learning, and knowing that adult learners come with experience and that it is really a partnership where we support each other in the learning process. When we talk about fostering diversity, it can really be a large scope, right? It looks at race, gender, ethnicity, age, socioeconomic status, sexual orientation, abilities, and cultural background. So when we think about fostering diversity, it's not just about numbers. It's about creating an environment where people from diverse backgrounds can really feel respected, valued, and empowered. One of the biggest hindrance, I believe, in my opinion, for fostering diversity is fear. Fear of the unknown, that discomfort with the unfamiliar and different perspective. And being consumed with that fear can really hinder the efforts to build diverse teams. So I would want to encourage us today to try to move past that fear and be curious about strategies that we can use to really foster diversity, as I strongly believe that we are better together. Some of the strategies for fostering diversity can include providing ongoing diversity training and increase awareness, understanding of different cultures and perspectives, establishing mentorship programs, encouraging open dialogues about diversity, allowing people to share their experiences without fear of judgment, and encourage collaboration and learning across cultures to build empathy and understanding among teams. Fostering diversity is a lifelong journey where the focus really should be embedding diversity in the organization's culture and operations, and it's not about just ticking off a box. Diversity in healthcare is especially important because it improves patient outcomes. When you think about diverse teams, they can address different needs and it leads to more accurate diagnosis and treatment. Having a diverse team reduces health disparities. Fostering diversity in healthcare helps in addressing and reducing health disparities that exist among racial, ethnic, and socioeconomic groups. And it can really build patient trust and satisfaction. When a patient sees a healthcare provider who reflects their background, they can feel more understood and comfortable, and it can also lead to improved patient satisfaction and adherence to treatment plans. So if we're not fostering diversity in our organization, we will not be able to give the best care to the community we serve. So here at St. Joe's, when we talk about integration, we talk about three pillars: education, mentorship, and access to resources for our IENs. And under that education, we have workplace integration programs and learning modules. And as Ruth pointed out, we did have Care Center come to us just this Monday and really went over some of the challenges that international educated nurses face. We had a group of clinical scholars, nurse educators, clinical nurse specialists, professional practice educators, consultants, and leaders. And some of the highlights from that workshop included the IEN's journey and steps to practice. So having us understand the amount of hurdles that they have to go through to help in their integration so that we can see from their point of view their struggles. Really looking at the IEN's needs. Sometimes it's financial, and so at St. Joe's, we've made commitments to even paying for their care registration, that $150, so that they can have case managers to help them on their journey. We look at the importance of a needs assessment, seeing where the gaps are for the IENs and addressing those. We talked about cultural humility and some of the strategies that we can use to support IENs with communications, with assessment, with documentation. I'm proud to say that at St. Joe's, we partner and we have the supervised practice experience partnership program. We have the observational job sharing, job shadowing, and we have the clinical scholar program that we all use to help our IENs to integrate into our organization. And then in-house, we have our EDIB department. And so we have learning modules that go out to leaders and educators, staff, some of which are like building inclusivity through anti-racism, transforming power and privilege, bias and microaggression, the impact in prevention and intervention, and unpacking anti-Black racism. The unpacking anti-Black racism was a collaboration between myself and the EDIB director, Sarita. We built this module, which has been rolled out to leaders and will be available to all staff. And the question might be, why is all this education important? Why all the integration workplace workshops, learning modules? And I'll put that into context by sharing a story. So in my clinical scholar role, I was consulted on a case regarding a senior nurse struggling to orient an internationally educated nurse. The experienced nurse felt that she was unable to connect with the IEN and was frustrated that the feedback she was given was not well received and practice wasn't changing. The issue was the senior nurse had given that feedback to the IEN in front of a patient, which the IEN felt uncomfortable with. The senior nurse, after seeing that practice wasn't changing, had a private conversation with the IEN where the IEN expressed her dissatisfaction with the public feedback. Upon reflection, the senior nurse acknowledged that at that time, she did not acknowledge what the IEN was saying and continued to say, "This is how I provide feedback." After the consultation with myself, she recognized that she could have been more mindful of the IEN's needs and preferred feedback style. And so the senior nurse acknowledged gaps in her understanding of cultural safety and the importance of adapting to communication styles to the IEN needs. Sadly to say, the IEN quit her position in the organization because she felt that the IEN did not feel comfortable asking for feedback, and she had become defensive about feedback stemming from previous negative experience of feeling belittled and by nurses on the unit. And so when I thought about this case, it really made me realize how important it is for the team to be open and supportive and create an environment where our IENs can feel safe to ask for assistance and receive feedback. So when I discussed this with the unit and the nurses, we talked about, not just looking from the perspective of the person giving the feedback, but also from the individual receiving it, and to make sure that they are feeling safe in the environment. And so it is essential to understand that safety comes from the person's own experiences and perception. And so it is important that as the host organization that we equipped our Canadian nurses to be ready to receive international educated nurses and to help with that integration, and to know that it's a two-way stream where the IENs come prepared and come to work and do what they need to integrate, but that we are also providing that environment where they can feel safe and they can successfully integrate into our organizations. Then when we look at mentorship, we have the clinical scholar nurses and we have preceptors. So just in case someone on the call is not aware, the clinical scholar program is a government Ministry of Health funded program. The nurse is an experienced nurse. She's supernumeric. And so she can go to the bedside with the IEN, new grad or nurse looking to upskill and provide that one-on-one support at the bedside. And so she can tailor that mentorship towards the needs of the IEN. And so we've found this program to be very successful with the integration of the IEN into our system. And I know, unfortunately, the story that I shared earlier is one of, that was not successful, but we've had many successful stories. One I could share, I remember starting to work with an IEN and she mentioned to me, you know what, I'm struggling with communication with my patients and their families and my colleagues. And she was unsure what information to share with family members. As from her background, she says, when the family comes in, we share everything, So the concept of privacy and confidentiality was difficult for her in our context. And so we went through those policies and of privacy and confidentiality. And then I developed scenarios in which we could go over how she could appropriately respond to improve her communication skills. To date, she is doing well on her unit. She is able to communicate with her family members, do patient teaching, talk with the staff, and still keeping that privacy and confidentiality. And she's now functioning the unit lead role on evenings and night shifts. So over the last fiscal year, we have mentored 71 IENs, and I just have a breakdown of the sites that we have the program. So we have at Mount Hope, we did 38 IENs, Finch Family Mental Health, 11, the Southwest Center, 2. We didn't have any at St. Joseph's, and we had 20 at Parkwood Main Building. So with every program, there is opportunities for growth. And so we really are trying to build a better network so that services are well accessed across all sites, trying to make sure that mentorship needs are filled, looking towards weekends and nights, that's a gap. And to build our clinical scholar nurse toolkit so that we can have more collaboration with partners like CARE, to get staff that are provided mentorship to IEN the support they need to help mentor IENs to get into practice and to transition well into our organizations. And then just some of the resources that we have here at St. Joe's. We have our EDIB department. We partner with CARE. We partner with DARAO for workshops like these and talks like these. We have our JEDI committee at our Southwest Center and our chess committee at Parkwood, Maine. And we make sure that IENs know of these resources so that they can become familiar with what it is that we offer when it comes on to equity, diversity, inclusion, and belonging. That's it for me. Thank you so much for having me, and I look forward to answering any questions that you might have at the Q&A.
Thank you so much for sharing that. And I just love our partnership and our continued partnership. I'm so grateful. But I think what's so beautiful is that we can learn from you what exactly is happening with our clinical and community partners. And I appreciate this lens so much. So I would like to open up the floor rather than me being selfish and asking all the questions I have. I imagine some of our colleagues in the room also would like to kind of question. So does anybody want to start?
So thank you, Therecia, for those stories. Actually, I got told right in front of me to say the only thing I like black is my coffee. So unfortunately, this elderly lady, she in her world it's just black and white. So very tough. But the good news is that I got to spend, that was in my days when I worked at Sunnybrook. And you remember there's a veterans wing to that organization. And then over a period of about 3 weeks, I become the best nurse she ever known. So it's just interesting how we connect at a human level, and every moment is a teaching moment. So I think that's why we all get into education. But I think that to be fair for the preceptors, I hate to be the devil's advocate, sometimes overworked nurses, they don't really paying attention. They don't even remember nursing 101, right? You would never ever do that to anyone. You know, dressing the person down, doesn't matter who the person is, in front of the patient is absolutely inappropriate, right? So I think a lot of the education is required. And I understand that in the clinical area, sometimes you're so desperate to get a preceptor. But our desperation, it create more challenges for us rather than solutions. So that's why we're very adamant that we need to prepare the preceptors. We need to get people who are really willing and passionate about supporting IENs to take on that very important role as mentor, as preceptor, and also the empowering. Like that's what CCNE can do, is that we are the middle people. We're not the employer. We're not giving them a performance assessment or risking their job. And then for the employer, we are not the union, right? So we are that neutral people that able to kind of work in between and help both sides of the fence to understand each other and how we can integrate the IENs. And it's not just doing for the goodwill. We need nurses. And as a Canadians, we all need to remember the charter, right? We welcome the world. We are Canadian. That's what makes us Canadian. And I think we need to bring all those values back to guide us in our everyday practice.
Thank you for sharing that, Ruth. I think a lot of your sentiments also kind of align with just the social political context of the world nowadays. So it's an important reflection to have. Does anybody else have any burning questions for our esteemed panelists? I think Mark has his hand up.
Hey, thank you for this great opportunity for IENs. Like me, myself as an IEN came here in Canada. And because the challenges of being an IEN doesn't stop during this nursing registration process, but it continues until the workplace integration. So my question is, because we reached the highest record of registrant in 2024 in the College of Nurses of Ontario. So, and then I see a lot of IENs are underemployed. And I'm just like looking at this areas and then thinking about this question, what strategies or policies can be implemented to ensure that the online application and resume screening process for internationally educated nurses remains fair, unbiased, and free from discrimination, while also recognizing their unique qualifications and experience.
Thank you, Mark.
So Mark, I don't know if you direct this question to employer rep here, that is Therecia, or maybe I can just address how we
Yeah,
deal with that
maybe, yeah,
issue.
whoever like can address these issues or
Right.
challenges that IENs are facing right now, especially
Right.
a lot of IENs are like facing challenges of job hunting and looking for a job because they were able to register last year, but until now they're still like facing the challenge of getting hired or getting a job or land to the job that they want.
So I would say that we need to work both ways. One of the things is that IEN are not, as I mentioned earlier, many of them have never need to write a resume or cover letter or anything like that. And in large employers such as St. Joe's, right? You're large, and many of the, particularly in Toronto, they put your cover letter and your CV through a computer, okay, a programming. So when you do not have those keywords, you're effectively eliminated, okay? So that's where Care Center come in, is that we coach our clients basically with all the things. So you need to match those keywords, then you will get somewhere at least, get yourself an interview. And at the interview, I often teach, sometimes I act as the employer. I interview people and we always give very honest feedback. And at the end, I say, you know what? I know I have a new pair of shoes today. It's absolutely nice. I never pay so much money for it. But you know what? Looking at my shoes is not going to give you a job. Well, so she started to laugh. I say, no, it's not funny, right? Because a lot of the nurses I mentioned from traditional cultures, they're not used to being interviewed and selling yourself. So they put their head down, looking down, don't look people in the eye. In Canada, it's big. If you are not looking people in the eye, they will say, oh my goodness, this person have no self-confidence, they have something to hide and all these things. So we try to bridge those barriers. We really need to say, you know what, this is how you play the game. I hate to use the word game, but it is a game, right? So you cannot change the culture overnight. You need to know what the employers are looking for, right? And you have to match it. So starting all the way from getting your first job, and sometimes don't minimize the power of being able to get into the system. right? So get in. Sometimes, sadly, people cannot use the skills because without the license, you cannot use those skills. But take it as a learning opportunity. Start as a PSW or whatever and get in, and then you learn and you get to know people and be the best PSW you can be. And your manager is going to recognize, oh my goodness, this is a fabulous worker, and they take an interest in you and they learn that you're a nurse. And guess what? The first vacancy come along, you will be the one that's getting it.
Yeah, and also, Mark, just to use the for the international nurses to use the programs that are available. So the SPEP and the observational job shadowing that organizations like St. Joe's have partnered with CARE to get in. So to get that experience. And even as a student, if you did your preceptor in an organization, you want to put that at the top when you apply to the organization. So using those avenues to network and to get in through the door. I am not an employer, like I'm not in HR, so I can't speak to how the filtering happens for that. But once you get in, we have programs, you know, we have the clinical nurse scholar, we have our preceptors, we have programs to help to guide you into that integration. And we're working on getting our staff there as well to make sure that the environment is safe, to make sure that they know how to communicate with internationally educated nurses. And some of those barriers and struggles and gaps that we've seen, we're trying to minimize those so that it's a two-way stream where the host organization is doing the work to make sure that the staff that is there is ready and welcome to integrate the IEN, and the IEN is doing their part to make sure that they can come and thrive, because we want to make sure that we have a workforce that represents the communities we serve. Because if we don't have that, then we can't serve the community.
Thank you for that. Just being respectful of time, and I know that this is such an important conversation. Maybe we'll field one more question, but the panelists have also shared their contact information if anybody wanted to follow up. So I see Carmen has her hand raised, and then we'll kind of conclude.
I was going to just make a comment on two fronts, and that was just to, again, acknowledge the amazing work that CARE does. Yes, we've had them in our organization a handful of times, and they've always had amazing presentations with concrete strategies to leave with. And so on the topic that Mark had just commented on about recruitment, so we had them come, and it was a year ago, but they gave an excellent presentation on recruitment and things that we need to think about from organization as we go to recruit, and how we do interviews and how we select candidates and all of those pieces, and has had excellent concrete strategies. So I really highly recommend that one in their workplace integration program. And then the other side, being in an organization where, as Ruth had commented, people have resumes, cover letters that are of differing levels, and it makes a difference. It makes a difference on who gets picked. We have small opportunities internally when we do our SPEP program, which is a supervised practice experience, but certainly really, again, highlighting the benefit of going. You can see a difference between a nurse that has had support through CARE versus someone who hasn't. There's quite a difference in their resume and their cover letters and their interview especially. So yeah, just wanting to give another hurrah for CARE and all the great work they do.
Thank you so much. Thank you.
Thank you.
Thank you. Thank you
Carmen.
so much.
Thank you for that. So, I'll also add on, I agree and reiterate everything that was just stated about CARE. And I'm also so very grateful for Dr. Cruz and the work that he's doing, and also for Therecia and what you're doing with everyone at the bedside and supporting. So thank you everyone for sharing with us today. I appreciate you fielding the questions and going slightly over time. And if anybody wants to reach out and follow up, we'd love to continue the conversation, I'm sure. And let's stay connected. So appreciate everybody for participating.
Thank you.
Thank you.